This ulcer is healed. I have no pain. I sleep well at night. So doctor says take a month off, and then I will come back on April 10th, and then he will check my blood flow again. And after amputation, I noticed that my lifestyle has changed a lot. The things I used to do easily, I cannot do it anymore.
Okay, the circulator boat, or also known as end-diastolic pneumatic compression, is a system of equipment which is delivering blood flow and improves the blood flow to the lower extremities.
I have a PVD. It's a peripheral vascular disease. And my primary doctor noted it in '89. My fingers and toes, they started turning blue. So he said that they cannot do anything till it starts giving me a problem. So it started giving me a problem in 2004. And on my left leg, I am also diabetic. And in addition to that, I have cholesterol. My cholesterol level is high. So this leg artery got blocked. So they tried to unclog the artery by putting me on a blood thinner and all that medicines. It didn't work. So they said they are going to do a bypass. So they, in the first time, they used the frozen one. That's meant from somebody else's artery, and they wanted to bypass it. They did it, but it lasted only 15 days. My body rejected it. So they said, okay, they will do the artificial one, the plastic one. So the second time I had a bypass, leg bypass, and they put the plastic one. It didn't work. It lasted for 15 days. It didn't work. So he says, the only option I have is the amputation. So in 2004, June of 2004, I had this amputation.
Mr. Schraff lost his leg because of severe ischemic changes, lack of oxygen.
Right leg started giving him a problem in 2007. I had two ulcers. One in the second toe, and the second in between the third and the fourth toe. So I went to about 3 vascular surgeons, and they say I have no option except amputation.
That he has a condition called scleroderma, and scleroderma is a connective tissue disease which is relatively rare, and what it is causing sclerosis of muscles and soft tissue, making the leg very thin and very hard.
My son knows a guy who makes the valve for those pumps there.
Oh, okay.
So he came to my son for a dinner. And during the conversation, my son told me that my father is going to have a second amputation and he's not happy, we are not happy and all that. So he said, hey, I know a doctor who can help you.
Sufficiently now he can even go out in the winter, which he could not do before. Scleroderma is frequently connected with something called Raynaud disease, which is oversensitivity of a small vessels causing on exposure to cold constriction and color change. The leg becomes pale and blue and changes color, depends on the degree of blood vessels constriction. And this condition is leading many times to ulcerations, which later on become extensive and patients develop gangrene and they lose toe after toe usually.
And Dr. Philip told me that, yes, I can help you. We will try. Give me 2 months. I said, okay, I'll give you 3 months. And I started on 2nd of June in 2008. And after 3 months, I noticed the difference. So doctor said, okay, you have to keep on continuing, and get rid of this ulcer and all that, So I think in the month of September, my first ulcer got cured. Yeah, I started getting a new skin there, and my pain was gone, and I was sleeping well. And by that time, the winter arrived, and during winter time, I have a problem. So I kept on having this treatment for the winter time, and now both the ulcers are gone. I'm walking, no pain, and I had a test about 6 weeks back when Dr. Philip told me that if I want, I can take a couple of months off, and then we will check again and see what happens. So I decided to discontinue abruptly. I thought that might not be good for me. So I started coming 3 times a week. Have me for 40 minutes. Every session is 40 minutes. It differs with the patient, depending upon his conditions. And those guys, they are, Adam and Steve, are really very helpful. They take care of you. They know what they are doing. They are very well trained, and they got a lot of experience. And I don't have a problem, so now I'm going to discontinue for a month.
Recently now he can even go out in the winter, which he could not do before.
Mr. Dara?
And I will see you after a month.
Thank you. After a month?
Month, yeah.
Oh, really?
I'm taking 1 month off.
Just finished?
Yeah, I'm cured.
Okay.
So now I'm going to take 1 month off.
Oh, congratulations.
Okay, thank you.
All right, bye-bye.
Have a good one.